guys, it is the docs from Pure Chiropractic. This is episode 5, I believe, of the Pure Perspective podcast. And today we are talking about something I am very, very passionate about, and it is the difference between pain care and nervous system care. And so I am super excited to talk about this today. I am ready to just share what we do in the office and how it's different from your traditional chiropractic office. So who wants to start? Who
So I
wants
can
to take
start.
it
Yeah, I
away?
mean, I've been in practice for almost 13 years. So if there's something I have seen, even within the walls of our practice, we've been through both of these worlds, right?
Mhm.
We've had times where we probably were way too pain based, and unfortunately, that is something we are absolutely working away from now because I don't see the value in that for our patients that I thought was there.
Yeah, long
Is
term.
it's a great reason why someone seeks out chiropractic care. But if we don't connect the dots to how pain is actually part of nervous system functionality, then when you don't have pain, you are under the impression that everything's okay.
Yeah.
And the reality is just like when we talk about kids, pain is the last thing that's going to show itself in most
Yeah.
cases. It's a buildup of the nervous system stress that eventually presents that way. And
Yeah.
so if all you do is clear out the pain response, you have done nothing to clear out the dysfunction underneath it that just creates the next layer and the next layer. And what we've seen in the practice's history is people who are seeing us strictly for pain care, and when they don't have pain, they go away.
Yeah.
When they come back with their next version of pain, it's harder and harder and harder to get their body to respond because it's becoming more and more resistant to that change.
Yeah.
So it's 100% that the nervous system has to be the driver. And that's why we do the scans that we do. And that's why ultimately the practice is the way it is because I've seen both of those personally. And one is way better for people and it's way more long lasting for them too.
Yeah.
Yeah, I
Absolutely.
think, like you said, like pain is the last thing to show up and it's the first thing to go. And so with the scans, we can really see kind of where we're having that dysfunction that turn that pain on because pain is kind of like a check engine light on your car. Like you
Yeah.
have to take your car to go get oil changes. Well, that's kind of like coming to us and making sure your nervous system is properly functioning and throughout like maintenance care. But a lot of times people only fix the check engine light and they don't get
Yeah.
the
The maintenance
yeah,
behind it.
yeah.
Yeah. Yeah. We, a lot of times we talk about like, I guess we're maybe diving a little quicker into maintenance care, and I think it's wonderful. So maybe I'll come back to this, but I do think, especially for adult populations, like we've got this idea that you only see a chiropractor for neck and back pain and headaches.
Mhm.
And since changing we've always talked nervous system
Mhm.
care. I've been around the office for nearly 10 years and I have been through the patient stage to the CA stage to the intern stage to the doc stage. And we've always talked about the nervous system. But I think at the end of the day, we still in our hearts wanted to help people get out of pain because that stops them from living the life that they want to live. Like grandparents can't pick up their grandkids and people can't work their jobs and people are struggling to just do daily life activities. So it's important that we still want to take away the pain. We still want that to go away. It's not that we're forgetting about that. But when we think about your brain sends signals through your nervous system to every part of your body. And when patients come into us and they are taking blood pressure medications or they are taking thyroid medications or they have menstrual irregulations or headaches, migraines, high blood pressure, low blood pressure, digestive issues, those all have a nerve that controls it that isn't getting good function to it. And so that's because of the interference. That's because as the brain tries to send that signal's not getting through clearly and effectively. So when we look at the scans, we can say, hey, we've got a certain degree of interference at this region or at this segment level that isn't letting that nerve control the function it's supposed to. And so whether that's, in your thoracics and it's not allowing your heart and lungs to beat the way that they're supposed to or breathe the way they're supposed to, and now you're on a statin or you're on a hypertension medication, whatever that is. I feel like for those patients that come in for the pain side of it, they're like, oh, I didn't even think you could help with my high blood pressure. I've had it for years. But when we start to dive in and we say, hey, your body is created to be able to handle these things. You weren't created to not be able to pump blood through your body or breathe regularly. And so if we can instill those nerves to have that communication it's supposed to, yes, we're going to take away your pain because the nerves can communicate better. We're not getting that response from the body saying, hey, something's wrong here. But on top of that, we're seeing those functions work greater and work better and more effectively for them. And so whether it's sleep or it's getting off medications or it's, I mean, we've got a patient in the office. She's been under care for maybe less than 3 months, I'd say. And she's a type 2 diabetic and she doesn't have to use as much insulin as she
Mhm.
was using before. And I just got chills talking about it because that's insane. Like that's incredible. But it's also like she came to us for low back pain and dizziness. And we are changing her blood pressure, her insulin resistance, and
Mhm.
her body's ability to just heal naturally. And so she's like, I want to stay here for forever. Like, I'm not planning on leaving anytime soon. And so it's just one of those things that she came in for one thing, and we've been able to convert her to see that
Mhm.
your nerves drive everything and the nervous system controls everything.
Well, and we've just said, like, which part do you want us to focus on?
Yeah.
Because we know within the neurology, 8 to 10% of the nerves in our body are nociception
Yeah.
fiber nerves.
Mhm.
They are pain sensing nerves. So if you want us to only pay attention to 10% of your neurology, we can.
Yeah.
Just don't see how that serves you in the
No,
long run.
Yeah.
It doesn't
no.
seem
Not at all.
to, I'd much rather have
Yeah.
a 90% functional state
Yeah.
than a 10%.
And the
Mhm.
way we used to describe it with our patients, I mean, we still explain it this way to some degree, but the way we used to talk about it, which if you're a practice member in our office, you have likely heard me say this or Dr. John or Dr. Anna say this at some point, but your nerves, like Dr. John just mentioned, only 10% of it feels pain. And so when you've got that 10% already showing up saying, hey, your knee is bothering you, hey, your head is bothering you, or this issue is happening, you've got 90% of that nerve that's already likely being interfered with that you can't feel. You can't feel it at all. All you know is that that function's not taking place properly. So you can't feel that your mid back interference is causing your heart rate to not do what it needs to do,
Mhm.
or have high heart rate or low heart rate or high blood pressure or low blood pressure. You can't feel it. And then all of a sudden you get that point where you're like, man, I got this like tight spot in my mid back and it's giving me trouble. That 10% isn't the only part that's interfered with. It's everything else before that that's been interfered with. You only know about it because that 10% is being, is sending those signals saying, hey, something's wrong. And so pain is like an alarm system for your body to say, hey, we need to do something about this. But if you get to it in that wellness state, then we can prevent it from getting to that point
Mhm.
of pain. So not that we don't want to take care of patients that have pain. Please still come to us if you have pain, but just know that you are going to see changes beyond your pain. You are
Yeah.
going to see improvements in your nervous system and in your body that we hope will keep you with us for a lifetime. And
Yeah, let's say,
like I
don't get
told
it
you,
twisted. People are still writing pain down on
yes,
paperwork
Oh,
every single
absolutely.
day in our
yes,
office, right? It's still something we see. It's still something that we are passionate about solving for them. The point is we don't want pain to be the focus
yeah,
because it's not a big enough piece of the puzzle. We
yeah,
realize it's the
Far beyond that.
motivator, but it's not as big a piece of the puzzle as we think. But
yeah,
unfortunately, when it's there, it's all people are thinking
yeah,
about.
Mhm.
yeah,
And so, especially for guys will delay taking care of everything in their body until it's ready to fall off of
yeah,
their body.
yeah,
And unfortunately, the more we dive into the neurology, the more we understand how the body's functioning, the more I am begging these men to please do something proactively,
yeah,
because it's at a certain point you can't get the full and complete healing that we want. And it's one of the
yeah,
reasons we love working with kids. They're a lot easier to get their body to
yeah,
do it right as it's already developing, versus with adults, you're already fighting the uphill climb
yeah,
of their nervous system
Mhm.
stress
yeah,
to that point.
yeah.
So it's just a different way of looking at it. It doesn't mean that chiropractic isn't great for pain and that nervous system care doesn't affect pain positively. It's just a different way of viewing it, that the pain is not the in and out of the office decider for someone.
Hmm.
Yeah. And I think a lot of people pain will make you do a lot of things. And so a lot of times what we see is patients have pain and then they go to another medical doctor and get imaging done and they find that they have a disc herniation or a tear or something. And it's kind of like an automatic like expectation to just go and have surgery. Before that, we have to again like work through all of their nervous system from when they were born to up until this point, and so it's a lot to work through, so that pain might be there for a good bit of time that we have to work through, but once we kinda get over that hill, we can maybe prevent some other things from happening or prevent those surgeries from happening or catch something before it even happens, so
Yeah,
I think that's a big thing for people to
yeah,
swallow that pill is like
And I think because pain is such a small percentage, you can positively impact the nervous system, the joint, whatever you want to call it, and you can make pain change. But if you don't really truly correct the healing part of that, and how the body's perceiving that area with inflammation and the stress response and the soft tissue
mm,
responses associated with it, you're just going to cycle right
yeah,
back
it's
to
going to
that.
come back.
And what I've seen in my career is every time you cycle back, it becomes a deeper journey to get their body to recover that again. And so, I mean, unfortunately, I've watched people do that where they come into the office for 6 months and then they go away for 2 years and then they're back and they have all the same problems, but they have additional ones on top of
Yeah.
that. And so, just getting in front of it, I know it feels like work and I know it's a requirement and something we're asking you to do, but I assure you the outcome of that consistency in your life will serve you much longer
Yeah.
than what you think.
That's the part that I feel like we might have touched on in the beginning, and maybe we haven't touched on it now. But we call them the three T's. A lot of chiropractors are even saying there's four T's now. So it's thoughts, traumas, toxins, and then technology. And so those stressors in your body and in your world cannot be taken away. So if we think about, like, as a CA, I used to say, I can't just put you in a bubble and ship you to the Bahamas and let you have a fun-free vacation for the rest of your life. It's impossible. We have to still deal with those stressors. And those stressors are what create those areas of interference within our nervous system. So whether it's our mental and emotional thoughts, whether it's the consistencies of our daily activities at work or big traumas like slips and falls, car accidents, surgeries. We've got toxins, the things we're eating, breathing, pollution in the air, the inflammatory processes in our foods. Those are things we can't control. And now you add technology on top of that. Our heads are looking down way more than they ever were 20, 30 years ago. And so you add all of those combined together, you cannot combat every single one of those by yourself. And that is where the adjustment is so crucial and so pivotal in that person's ability to heal. And so when we do those scans, when we do those, I'm very passionate about this, clearly. But when we do those scans and we show where these areas of interference are happening, and we say these are because of the three, maybe four T's, whatever you want to call it, those are all influencing your body's response to healing. We have now gotten you through this, let's say, corrective care phase. And they say, oh, I'm good. I've healed my body. Everything's good. My body is working well. I don't have pain. I don't have symptoms. I can sleep better. And I said, okay, those stressors are still there. They're not going away. And so we need to it is a lifestyle change. Like, maintenance care and wellness care is the idea that you want to maintain your body's ability for your brain and nervous system to send the signals that they're supposed to send without the kickback or the interference that creates those aches and pains and symptoms later on down the road, or the dysfunction that then occurs where you have to go back on your medications, or you have to do this, you have to do that. Now, I can't say for every single person that you're going to walk in, go through a corrective care phase or a restorative care phase, and you are going to get better and walk away and your problems are going to come back. I can't guarantee that that will or won't happen, but in our experience, I would argue like 90% of the time, if not more, that happens. And so
Well, the
you've
other
got
10% are too scared to call us because
yes,
they know they
exactly.
messed
They're
up,
like
right?
prideful. Yeah,
Yeah.
exactly. And so our thing is when patients say, "Oh, well, I'm going to have to come here for forever," and I'm like, that's the beauty of the fact that your
What a blessing.
adjustment is helping your brain send signals the way it was created to, because we live in a world where these thoughts, traumas, toxins, and technology are just wreaking havoc on our
And
nervous
only getting
system.
If minutes a
Yes.
week has my body function correctly,
Yes.
how is that not
Why not?
a transaction
Worth
that's
it.
100% worth it?
Exactly.
It's funny that you brought up vacation because I think Anna and I were talking about this. I think it was last week in the office, but we have a constant fear from people that when they go on vacation
They're gonna
and
be
they've
worse.
been enlightened to how well their body functions, that their whole life is going to fall apart. And if you want concrete evidence that stress is part of the deal, we were literally joking about, because we had somebody go on vacation, another person came back and they were like, I was great until I came home.
Yeah.
And it's like, well, yeah, you got to escape all of the stressors
Yeah.
that chew you up all the
Yeah.
time, that has you feeling the need for you to be adjusted, which is great. And yet when you go away, those things all seemingly go away and your body functions better. It's like, well, that tells you right there that it's your
Exactly.
nervous system stress
But
response
it's not
to all of these things.
realistic to live
So
on
yeah, what are you gonna do?
vacation.
Go in a bubble? Like you're gonna protect
Yeah.
yourself from yourself every day? It's not real.
Yeah. Yeah. So if you hear us talking about that maintenance care, that wellness care, that proactive care, it's for a reason. It's because we just went through the work of going through that corrective care phase, and we've gotten you, yes, out of that pain response, but also in a better spot just naturally with your body's ability to sleep and regulate and heal, and digestion is better and immune function is better. And all of those other things are kind of cascading upon one another. They're creating a positive, healing property. Right. And so if we ask you, or we recommend to you that we are suggesting corrective or maintenance care beyond corrective care, it's not because we think that, we just want to see you every single week. Of course we do, but we want for your nervous system to maintain the work that was put in over the
Mhm.
last corrective care plan.
Yeah, I mean, big on analogies, but, like, your nervous system is kind of like a muscle, like, you can't go to the gym one time and expect to be,
Ripped.
bodybuilder
Yeah.
status, or, like, you can't eat healthy one dinner and then have, like,
Expect to
this
lose weight.
healthy. Yeah.
Yeah.
So, like, your nervous system is the same way, like, it has to have that
Time and
constant
repetition.
reassurance, repetition, just to maintain life and
Yeah.
Well, and so I was going to ask Dr. Anna to kind of hit on one other thing before we wrap up is just with your school, you got a lot of background in soft tissue work and
yeah.
those things. And so I think knowing nervous system function, but also knowing soft tissue, I think you have the unique ability to speak to how much more effective we love soft tissue work. I saw a massage therapist this morning. We love that stuff, but speak to the effectiveness of that stuff preventatively for pain and
Yeah.
how much better it gets when you have your body functioning correctly.
Oh, absolutely. I mean, I went to school and we did like all the rehab stuff and all the soft tissue stuff. And it was great. I loved it. I'm all about, going and moving and just keeping your body in that. Yeah. But it's your nervous system is that foundation, and your muscles don't know what to do if your nervous system isn't telling it what to do. So if your nervous system has that dysregulation, it won't talk to those muscles and talk to the things that support your joints and allow you to move. All of the just walk the way you walk and create some imbalances. And that's just, it all goes back to your nervous system being able to communicate with those areas. And if there's interference, then those things can't function like they need to. And so that's where we run into a lot of the pain based side of things, which again, massage and everything is great whenever we need it. But sometimes we have to remember to go back to what the nervous system can do and how strong we can build it up to be and adapt to all of those changes.
Well, and it's the difference between building on a really solid foundation or building on one that might have a couple of cracks in it. And
That too, yeah.
go build any structure on a cracked foundation and let me know how that goes. And it might not fail you immediately, but it's just a matter of time until it
Yeah.
does. So,
Yeah.
the point is, as we wrap up, is don't let pain be the deciding factor. Even if you don't have pain, get yourself evaluated. Find out where your nervous system's capacity
Mhm.
is, because tomorrow might be the day that you finally tip your scales into that pain state. And now we've got that much more work to do to try and recover that back. So get those inside scans.
The last thing I want to say, if you're around our office, you've seen the gas versus brake pedal analogy. I think it's a really great resource, and we can always throw it up on our socials or something like that if anyone's interested. But it's a great resource to see how those thoughts, traumas, and toxins are building up in your body and how it reduces your threshold to be able to navigate stressors in the future. And so if you think about the parent that's impatient with their child, or you've got the teacher who's overwhelmed by 30 kids all talking to
Mhm.
her, or him. And then you've got the business owner who's just at their wits end because they've got way too many things on their plate. When you get nervous system regulation, your ability to navigate those stressors becomes greater. So you've got a greater threshold. You're not at, going 0 to 100 anymore. You are going, maybe you're hovering at a 10 or a 12. And that gives you a greater ability to withstand all of those other struggles that you might experience throughout your day. So, yes.
So
And
funny you said that and you mentioned business owner, because I feel like you were looking at me.
I'm
But
not.
ironic part is and we did this the other day and we talked about how we're going to get this out because we talk about the scans. We want to show more examples of that. But what we did with me the other day when I was having a nice stressful
Yeah.
morning with some
Yeah.
business stuff in the office is we ran a scan on me. We got me adjusted and then we immediately ran another scan. And so
Yeah.
what I'm going to do either on here or on our YouTube or our other channels, we're going to post that comparative with at least me or all of us going through that to go, this is what stress looks like in the moment, but look how quick you can change it if you're willing to do the work to get to a place where your body can be. I mean, I've been under care since I was 13 years old. I've
Yeah.
built a pretty adaptable nervous system
Yeah.
where I still deal with stress. I still fight those
Yeah.
challenges, but the ability of my body to regulate itself back to normal is exponentially greater than it would have been
Mhm.
otherwise. Look forward to that one. I'll figure out where we're going to share that. We'll keep you posted, but
Cool.
listen, don't be in pain. Don't motivate yourself based on pain. Be better than that. Okay. You guys have an
Sure.
awesome rest of the day. We'll see you on the next one.
Bye.
Bye.